I have some online questions that have come in. Here's one from Tampa, Florida. And the question is, do I have to go to Europe to get a disc replacement, or why would I get it done in the United States versus Europe?
When I first opened up the disc replacement center in 2014, that was a very, very common scenario here in Salt Lake City, Utah, as well as in the surrounding areas, that commonly I would hear patients that were traveling to Europe to get artificial discs. So part of my focus, both locally in Utah as well as kind of along the West, was to really focus on educating my patient population, informing them that this option is available to us here. It's been available in the United States. The first artificial disc was approved in 2007, so now it's almost 14 years. So we have the technology here, we have the expertise here, and at the current time, really, I see really no reason why a patient should be traveling to Europe to get any type of cervical disc replacement. Both the options, as well as the experience, as well as the techniques, is available here in the United States.
Todd, do you want to add to that?
Yeah, and most insurance companies happily approve cervical artificial disc replacement here in the United States. 1 and 2 level is very easy for, I'd say, most of the insurance companies to authorize. So your health insurance should provide authorization. The other thing I wanted to mention about these artificial discs in the cervical spine, because we were relating it a little bit to like a hip replacement, which might last 25 years. These artificial discs, some of them have lasted on the machines for 70 life years. So they're really a one-time thing. They really don't wear out, at least the hardcore polymers that are most of the discs that are FDA approved except one. And possibly the ceramic will last as long as well. But so they're really, it's a one-time thing if they're placed properly by a skilled surgeon in the right area to treat the right condition. And most of these never need to be revised. So it's a very satisfying operation, Tom.
So Rick, let's talk about multiple levels, because the FDA had 1 and 2 level studies. The insurance companies fairly regularly authorize 1 and 2 level study or 1 and 2 level treatments. What about the people that have 3 or more levels? Can you talk about that?
It happens. People, they're not cookie cutters. They don't, come out of the factory, so to speak, and just have 1 and 2 level disease as they get older. So 3 level is not uncommon. 4 level is certainly lesser. And we do that many disc replacements. It's not common. I mean, we don't do a lot, but there are some individuals that are truly candidates for that. And the option for them used to be, well, you do a 3 or 4 level fusion. And as Todd said, we only have 5 discs in our neck. So if you do a 4 level fusion, guess what? That last disc that may or may not be normal is toast and will need another operation. So it's not common. And, your insurance is probably not going to pay for a 4 level unless you have some extraordinary situation with your insurance or self-insured. But it's a reasonable option. It's, obviously not as common as 2 level. And in my practice, I probably do as many 2 levels as 1 levels, not that many 3s, and, 4s are rare.
The insurance companies over the past 5 to 10 years have been much more diligent in gathering outcomes data. And some of the data that's been published does show that artificial disc patients cost less money to the insurer and their outcomes are better. So I've used some of that data to then, if I have a patient comes to me who needs a 3 level disc replacement, or if a patient needs a disc replacement next to a prior fusion, to then even though it's not part of the insurance company's policy guidelines to cover these hybrid surgeries or to cover 3 or 4 level surgeries, I will insist on having a peer-to-peer review with the insurance company's representative, who usually on the other end, if we can ask for it and get it as a spine surgeon, you can make an argument to have them pay for this off-label or 3 level surgeries. And not uncommonly, I've been able to get them approved. And in the case where we can't get it approved, some of these patients have looked at Europe to possibly go to Europe to get a 3 or 4 level surgery performed. There used to be a time where perhaps traveling to Europe cost a little bit less money, but I believe now, especially with the cervical spine surgery, many of these surgeries are being done on an outpatient setting. The costs of having these procedures done in the United States are equivalent, if not less, than they are to travel to Europe.